So as a physical therapist, I get a lot of questions about scans and MRIs. And the number one thing that I see on scans and MRI reports for our population here in Northeast PA is spinal stenosis or degenerative disc disease. And I just want to explain that. A lot of times people will come in with that report and tell me, I don't understand anything that's on that report. I have it, I don't know what's wrong with me, please explain it. So I'm going to do that in a quick video. Here is a spine. If I bring that really close, you could see these little white things are your vertebrae. The clear plastic thing represents your disc. Those little yellow plastic cords are representative of your spinal nerves, the nerve roots coming off of your spinal cord. These are just different structures or attachment points for muscles in the back of the vertebrae. So that bone is the same as this bone that wraps around. That's one piece of bone all the way from there to there. And you can see this healthy amount of space between this bone and this bone. If we count them, you'll see the last lumbar vertebrae here is L5, 4, 3, 2, and 1. So this is the disc between L1 and L2. And there's a space there where I'm sticking my finger, and that's called your intervertebral foramen. So if you see that on a report, that's what they're talking about. It's just that little portal that this little doohickey sticks out of your spinal nerve. So that has a lot of room in there. What happens with age and degenerative changes, you'll see the narrowing of this space. That disc will become more narrow. And because of that, that space will become narrow. And they basically just judge it based on thirds. So if it's less than a third compromised and a third of your space, it's like a third smaller, they'll say min to mod or minimal stenosis of that vertebral foramen or the lateral foramen. In this case, this is the left side of a human body. So they'll say left foraminal stenosis at L1, L2. If it's within that 2/3 range, they're gonna talk moderate. And if the space is compromised by there's only a third of that space remaining, they're gonna tell you that that is severe narrowing or severe stenosis of the spine. So that's what they're talking about when they grade that in mid, moderate, or severe. That's the area that they're talking about. And that's what's diagnosed as spinal stenosis. When they see the space of this disc becoming smaller, and you can see that on an x-ray. The x-ray picks up the bone, the disc space shows up as black because it's not mineralized bone, and they'll just judge the height of each of these segments, and they'll say, well, that one at L1, 2 looks degenerative. They'll diagnose you with degenerative disc disease. It's not a disease. It's not something that where your body's attacking itself, or you have an autoimmune problem, or you have some type of foreign invader in your body, or you have something contagious. That's what we think of when we think of disease. Degenerative disc disease is a bad name. It should just be a smaller disc space. That's what they should say. There's no disease going on there. It's a wear and tear phenomenon. And also, people generally tend to get smaller at those spaces over time. So that's pretty much a natural part of aging. You'll see very few 80-year-olds without some significant decrease in their disc size. So people will freak out when they hear disease. Don't freak out when you hear disease. It's just narrowing of that disc space. So I hope that makes sense. The next thing I want to talk about is what the heck can you do about it if you're diagnosed with spinal stenosis. So you'll see that space is narrow. First of all, I want you guys to think about how important it is to do the right things and avoid the wrong things. And this is the kind of talk I have with all my patients. If you look really closely, I'm going to bring that close to the camera. You can see those spaces there. Watch what happens when I extend this fake spine. You could probably see that that space narrows down a bit, and that there's less space to begin with. So that's natural. When I extend my back, if I stood up and arched my back, I'm gonna make those spaces narrow. If I were to round my back, you'll see those spaces open up on this spine. So narrowing, opening. So if a person was diagnosed with spinal stenosis and they came in and we watched them move and they had a posture that was really arched, guess what things I'm going to do? I'm going to look at why their posture is really arched like that. Their butt's way out here, and they have pain right through here, and they have an MRI or an x-ray that says they have degenerative disc disease or spinal stenosis. I have to get that person, I have to find out why, and then I have to correct their posture so that it's more neutral. So that big butt out posture goes away and we get more of a neutral posture. That's really important. So I want them to avoid this position where they're really arched, and I want to get them a little bit more neutral. Those patients also could have a really hard time with flexibility in the front of the pelvis. There are muscles that attach to your hip that go right along where my hand is, and if my hand was tight and it pulled every time I took a step, that would arch my back and create that compression through your spine that you're probably feeling when you walk without support, when you walk through Walmart or the grocery store, and this hip could pull on that back and really give you that compression. So it's not rocket science. When I see somebody with really tight hips, stenosis in their spine, and problems walking, we have to elongate this muscle so that their spine can get in a more neutral position and not get hyperextended every time they go to stretch that hip and walk. So that's just a few examples of what's going on a scan, what I'm talking about with tight hips and what you can intervene. There might be other things that are wrong with one person and not wrong with another. That's why we do an evaluation. If it was possible to treat everybody with a video, I would be out of a job. I'm giving you all this information because it's important for you to know, you don't have to freak out based on your findings on your MRI. You need to get looked at. You need to find out, why am I like this, or why am I having this problem, and what can be affected through manual therapy or exercise. What can I do to keep myself going as functionally as I can with as little discomfort or little dysfunction as I possibly can. That's the kind of goal that we have and the discussion we have with physical therapy. This is what I expect you to do. This is how you can keep yourself doing the things that you like for a long period of time, how you get more mileage out of your car. This is the maintenance type stuff you have to do to keep this back healthy and from getting any additional problems over time. So I hope that explains a little bit about what we do as physical therapists at Elite Spine and Sports. If you have any questions, just ask them in the comments below, and I will try to get to every single one. Thanks.